Today, we're going to talk about liposuction. Liposuction is a fat surgery. What we're doing with liposuction is we're just changing where we store calories. Fat is a storage compartment. If you take calories in and you don't burn them the very second you bring them in, they're stored as fat. Our problem areas have a higher concentration of fat cells than the normal area next to it. So because of this, when we bring in those extra calories, they all go to the problem area before they go to the normal area. Now, the whole reason why liposuction works and the reason why we have a problem area that stays there permanently is because fat cells don't replicate. We're all born with a certain number of fat cells in certain locations. We keep the same number throughout life. If you gain weight, each cell gets bigger, and if you lose weight, each cell gets smaller, but the number never changes. So our problem areas just have a high concentration of fat cells, and we're going to always gain weight in that area first and lose weight in that area last because of that high concentration of fat cells. So that's where liposuction comes in, and it makes it a unique procedure because once you change those concentration of fat cells, they are forever changed. Because the fat cells don't replicate, if you can get a concentration of fat cells that are even throughout the body, when you gain weight and when you lose weight, you will gain and lose weight evenly. Liposuction doesn't change how many calories you store or is not a weight loss or weight changing procedure. But what it does do is permanently change where those fat cells, where the calories store. So if I can get the concentration of fat cells on top of the back, the waist, and the hips exactly even, you have a smooth curve. If you gain weight, you get wider, but the curve will stay because the concentration is even. If you lose weight, we get smaller, but the curve will stay because the concentration is even. So that is the key to what we're doing when we do the liposuction. The perfect liposuction is an even liposuction. It is not perfect to take away all the fat cells from one place because liposuction is a rob Peter to pay Paul type of surgery. If you take away all the storage compartment from one place, you'll gain weight someplace else. So theoretically, if you took every fat cell from the shoulders down, every fat cell, from the back, the stomach, the legs, if you gain weight, now you gain weight all in your neck and your head. And that's not a pretty sight, and there's nothing you do to fix that. So even is perfect. Taking every fat cell is not a perfect liposuction. So that is kind of the fundamental idea of what we're trying to do when we do liposuction. We're trying to change those concentration of fat cells. Now the other important part of liposuction is the skin contracting. When you do superficial liposuction correctly, you will irritate the skin and you will get the skin to contract. If you do this liposuction correctly, the skin will always contract. It's not really a matter of if it'll contract, it's a matter of how much. The better the skin tone, the more it will contract. The less the stretch marks, the more it will contract, but it always will contract. So that's one of the key parts of liposuction. The other things we kind of think about is is always being conscious of making the liposuction even, because we don't want to burden someplace else with gaining weight. Physically, what you're doing when you do liposuction, you're taking small cannulas. It could be anywhere from 2 millimeters in diameter to 5 millimeters in diameter, and you're coring out fat cells. So you're taking a solid and you're making it into a Swiss cheese. Now, when you finish with that, you kind of left with maybe like a sponge, or like I said, like a sponge or a Swiss cheese. So now all those holes where the fat cells were is where the fluid will collect. This is what the swelling is. It's fluid in the holes where the fat cells were removed. The way the swelling goes away is that all those holes heal close. So if we start off with something 3 inches thick, as it heals and collapses, it'll collapse down into something 1 inch thick. So now we have moved the skin. If the muscle in here, the skin is here and it's 3 inches away, now we've moved it down to 1 inch away. And this is the powerful thing that's changing the shape. Now if the skin got looser, it wouldn't be a good thing. But if the skin contracts with that, then we have a nice result and a good appearing a liposuction. So those are the things that we're trying, that's kind of mechanically what we're trying to do with the liposuction. Now, with the recovery, our idea is to kind of get those holes to collapse as fast as possible. If we have tissue and tissue here and tissue here and water in between, it cannot scar together. So when we wear a garment, we're trying to make that tissue touch so it can scar together. When we do massage, we're trying to push that area together to to make it scar and stick together. When I put a tape cast on you, I'm trying to collapse that area, get that area to touch. If we can get those areas to touch, the faster we get them to touch, the faster swelling goes away, the faster the skin contracts. The pain is also just will go away also, because really the pain is caused by the swelling. The swelling puts pressure on nerves and gives you pain. So the faster you get the swelling out, the faster you get that skin to contract. The faster swelling out, the faster the pain goes away. So that's kind of mechanically what you're trying to do with the recovery. Now, the recovery. First night is the worst. It is very painful. It's a throbbing, achy, bruisey kind of pain. Not a knife pain, not a sharp pain, but a throbbing, achy, bruisey kind of pain. The second day is better. This pain probably decreases by 20-30% the second day. The first day, and then 48 hours later, the pain is probably down by 50%. Most folks can be, are up and around by day 4, day 5, and they're doing much better. The average amount of time people take off from work is for a liposuction could be 5 to 7 days. Had the stoic folks go back to work at 2 days. Some people will take a week to 10 days. But on the whole, you start to turn a corner about the 4th or 5th day. The swelling actually takes 3 months to get 90% of the swelling going away. In the first month, maybe 50% of the swelling goes away. In the second month, maybe 70%. By the third month, 90-95% of the swelling will go away. So it takes time for all those areas to heal and scar close. So no one looks their best at 1 month after a liposuction. Everyone has a smaller waist and tighter skin at 3 months than they do at 1 month. So it's a slow and gradual process, but you do notice a change the very next day. There will be a change in the shape the very next day after liposuction, and you'll look very good, but you'll look better in a month, and you'll look better than that in 2 to 3 months. So far as activity, I recommend no exercise for 2 weeks. At 2 weeks, light exercise, and 3 to 4 weeks, heavier exercise. If you do too much too soon, you get more swelling, and it takes longer for the swelling to go away and longer for you to heal. So that's really the determining factor. After 2 weeks, after 3 weeks, you kind of just use your judgment as to the activity. Pretty much, you can do anything that does not make you have swelling. There's nothing to rip or tear when you do a liposuction. It's just that if you do too much activity, you get too much swelling. So after 2 weeks, after 3 weeks, you try to increase your activity. And if you don't have swelling after you do it, you're fine to do that. If you do have swelling, you have to wait a week and try again later. So far as the garment, I recommend the patients wearing the garment 24 hours a day for 1 month. And then after 1 month, again, it becomes trial and error. You take the garment off overnight. First step would be to take the garment off overnight. You don't have additional swelling in the morning, it's fine to be off at overnight. Maybe a week or 2 later, now you can try to take the garment off when you're sitting down, eating dinner, or just sitting down relaxing, because when you're resting, you don't get a lot of swelling. The last thing you want to do is to think about taking the garment off with exercise or activity. When you're standing all day is when you're going to get more swelling. When you're exercising or very active is when you're going to get more swelling. So everything you do is really kind of a trial and error so far as the activity and the garment. Again, it will take 3 months for you to get the majority of the swelling gone. And everyone looks better and looks significantly different at 2 to 3 months than they do at 1 month. So that is the kind of the idea of the recovery. Now, the complications. The complications that you always have to worry about whenever you have anesthesia, and I do the liposuction under general anesthesia because I think it's safer. When you have general anesthesia, you have airway control. If something happens, you can control and breathe for the patient. If you do this under local and something happens, you don't have airway control, so there's not as much assistance as you can give. So in that fashion, I do think that general anesthesia is safer. But whenever you have general anesthesia, you're at risk for blood clot. When you have general anesthesia, your muscles are paralyzed, your blood vessels dilate, blood can sit still in your leg and clot. If it clots in your leg, it's called a deep vein thrombosis. The sign of that would be one leg swollen and painful, the other one normal. The dangerous thing is called pulmonary embolism. The clot breaks from the leg and goes to the lung. Now, if that happens, it would cause shortness of breath or chest pain. That's the emergency of the situation. That's the 911 of the situation. That's the thing you don't wait for and things like that. During surgery, we use what's called a sequential compression device, which is a pneumatic pump that's placed in the legs that periodically just compresses the leg and makes the blood flow to try to decrease it from clotting. We also use blood thinners in the appropriate patient who is a high risk for clot. Those things can also be done. After surgery, it's important to move and to drink. If you're dehydrated, your blood's thicker, you have more chance for clot. If you sit still like a statue, the blood sits still in your leg, has more chance for clot. So moving after surgery and being very well hydrated are the things we do to prevent clots. That's what the patient can do to help themselves to prevent clots and things like that. Liposuction is a dehydrating type of procedure. And the reason why is because when you do the liposuction, I think of it kind of like an internal burn, meaning that just like a burn makes a raw surface outside the body and you weep fluid outside the body, the liposuction makes a burn inside of the body, and so you weep fluid inside the body. So all that fluid that's weeping is fluid that's weeping from your blood vessels. The only storage compartment for water in your body is really the blood vessels. So when you swell, if you swell 1,000 cc's, you have weeped 1,000 cc's of fluid out of your blood system. So liposuction pretty much automatically makes you dehydrated. So you have to compensate. You have to drink a lot of fluid to keep up with that. If you go to the bathroom 10 times, in the night after the surgery, that's also fluid you lost. You've got to replace that fluid. So those are the things we're doing to try to prevent these the problems with blood clot. Now, other complication you have to worry about. Infection can happen with any surgery, but it's very rare with liposuction. Personally, I have seen an infection with liposuction, when I was a medical student, have not seen one since. So it can happen, but it's very rare. The other things would be contour irregularities. The liposuction is uneven, or the tissue heals unevenly. The way you get a perfect result with liposuction is to have a perfect liposuction, leaving exact, even concentration of fat cells, a perfect garment that puts even compression on the tissue, and perfect massages. So our road to perfection, is a narrow road, and all these things have to be done properly in order to get the best result. If you have a perfect liposuction and then a garment with seams, with indentations, you can get a permanent indentation, and you can ruin a perfect result. You can have a perfect garment but not a perfect liposuction. You can also not have a good result. So these are things that you have to consider when you're doing your recovery with the liposuction. Other complications have to do with the complications related to anesthesia. It is general anesthesia. You can get pneumonia after anesthesia, you get laryngeal spasm after anesthesia, you get atelectasis after anesthesia. Those are things you have to consider. Lastly, when you're doing liposuction, if you place the cannula in the wrong location, if you poke through the muscle, you could get an internal organ injury. You get an injury to a bowel or even a lung. If you have hernias that you're unaware of, you can't even go through a hernia and injure the bowel. So these are things that you have to look out for, and these are complications that can happen with liposuction. The real dramatic thing about liposuction is that it is a powerful tool to change the look of a person. I think it's probably one of the things that makes one of the so far as cosmetic surgery procedures, a procedure that makes the most change in your appearance. The skin contracting is a big deal, and that is the things that we're trying to do with the liposuction. Here's just one example. If you kind of look at the before and after, if you kind of look at the area of the waist or the flanks, the fat is thicker here, and she has more fat and a thicker layer of fat through the bottom of the abdomen than she does the top of the abdomen. You can see how after the liposuction, we've got more of an even concentration in the back, the waist, and the hips, so there's more of a smooth curve. Here, we're having a heavier concentration here. So that's what we're talking about when we do the liposuction. We change the concentration of fat cells in those problem areas. We have lowered the concentration of fat cells here to equal the concentration in the normal area. Now, if you look at the back, you can see again, higher concentration, thicker fat cells here, also here. And the skin is looser, but the skin does contract, and you see it's tighter. So now we've got high concentration, low concentration, high concentration. Now afterwards we have more of an even concentration. Again, on the front of the abdomen you see the skin is tighter after than it was before, and again, a higher concentration of fat cells here. As we even out those concentration of fat cells, we get the improvement in the shape. So that is the idea of liposuction. Liposuction is a procedure that gives you a permanent result because fat cells don't replicate. Once you change their concentration, they're forever changed. It is not a weight changing procedure. If you gain weight, if you take in calories, you will gain weight. But the shape and things should be consistent. Even if you gain weight, the concentration of the fat cells don't change, so you should gain weight evenly if the liposuction is done correctly. The last thing is, if you get the skin to contract and you get a tighter trunk, you have a better look. And that's dependent on doing the superficial liposuction correctly. So that is the idea of the liposuction. Oh, there's one additional thing. Liposuction does not affect, future pregnancies. Tummy tucks do. And what happens with tummy tuck is you tighten the fascia, you tighten the muscles, and it causes problems during pregnancy for the skin and the abdomen to expand for the baby. The liposuction doesn't affect a future pregnancy because you're affecting skin and fat, and skin will always stretch, when during a pregnancy or with any other situation. So that is one thing to consider. Liposuction is something you can do when you plan future pregnancies, and tummy tuck is something you probably shouldn't think about doing when you plan future pregnancies. I guess the last thing is, the tummy tuck versus a liposuction. The tummy tuck is necessary when the muscles, the abdominal muscles, and the abdominal fascia are weak, and you have to tighten the abdominal musculature. This is the case of a person that has no choice but to have a tummy tuck if they want to make a flatter abdomen. If the muscles are strong and the stomach is round because of skin and fat, liposuction is an option for that patient. So that is really the primary difference between liposuction and tummy tuck. Who should have tummy tuck? Who should have liposuction? Okay, well, thanks for watching this video on liposuction, and we'll try to make more videos in the future. Take care.